Thank you for listening to the Bladder Battle Podcast special series, Flarey Tales. This series gives those alike living with bladder conditions, such as interstitial cystitis, a chance to share their personal journey. This series is also intended to bring awareness and create conversation around the illness. This podcast is not intended to be a medical alternative for physician care, nor to treat, cure, or prevent any illness. So please always consult with a physician for professional medical advice. Today we are talking all about empowering women with chronic illnesses and how to live a fiercely resilient life. Joining me today is clinical psychotherapist, founder of Fiercely Resilient, cancer survivor, and IC warrior, Tacha Kasper. So Tacha, welcome to the show.
Hello, and I am so excited to be having this conversation with you, and thank you for having me.
Absolutely. I'm very interested to learn more about you, just based on your experience as a psychotherapist. I'm very excited to kind of pick your brain and how that's been helping you navigate IC. But before we get into that, I just want to kind of understand what your experience with IC has been. So if you can briefly tell our audience a little bit about your personal story and when you were first diagnosed.
Sure. So I was diagnosed with IC in 2005. It was relatively a quick diagnosis, all things considered. So it was about a 4 or 5 month process from onset of severe symptoms to diagnosis. And it was only because a friend of a woman in the office that I was working had IC and said, "But that sounds like IC."
Oh, wow. That's lucky.
Yeah, but I had symptoms and issues since childhood that I didn't know were not normal. Right? Like frequency, and tons of UTIs in my teens and early 20s. And at that time, my OBGYN just had a standing order for antibiotics. They didn't even test the urine at that time.
Wow. That's crazy.
Yeah.
It's not good.
Mm-hmm. No. So I could have been having flares, right? And then you take antibiotics. So it's certainly, been a long time issue as far as symptoms for myself. So that's my IC journey. I also had endometriosis. So in 2008, 3 years after my IC diagnosis, I had a full hysterectomy. And then fast forward to 2014, I was diagnosed with triple negative breast cancer. So I think God wants me to have had everything a woman can have.
Yes, that's what it sounds like. And that's just so much. That's so much to deal with in less than 10 years. So yeah, I can only imagine what you have been facing. That leads me into kind of my next point. So not only are you an IC warrior, you also have endometriosis, which is, from what I hear, pretty terrible. It can cause a lot of symptoms, a lot of issues. It can really affect your entire body. And then you get a cancer diagnosis. So how have living with all of these, in just short of a decade, how has that really affected your life positively and negatively? So some of the things that I usually ask audience members is to really kind of break it down into a couple categories. So how has this affected your career, your mental health, and your relationships?
Okay. Yeah. So it's affected all of it. I like to say that chronic illness affects every stitch of our being, that there's not a part of us that goes unaffected. And for me, I'll kind of start with the career part, because I was diagnosed in 2005, and being a good type A perfectionist, I managed myself over the course of 5 years straight into the ground and on the brink of on the brink of death, basically, because I wasn't listening to my system. And I was working in corporate America and traveling every other week. And I was doing a job that I loved and making really good money. And it just got to a point that my doctors, 6 months previous to stopping working, they were like, you need to stop. And I was like, well, that's not going to happen. I have kids that need to go to college and teenagers, and, I love my career. Why would I stop working? So my entire identity, everything, financially, all of that was wrapped up into my career. And I'd worked a long time to reach this kind of pinnacle, or so I thought. And so when that happened, the short version is I lost everything. I lost, the title, my identity of who I thought I was, the financial part of it, all of it. And just it affected my ability to, as a mom, as a wife, as a friend, as, this career, and, what was the future going to look like? So for 2 years, I went through a bunch of series of surgeries and treatments to get back to stability. And during that time, I battled depression, but I also was able to do a lot of prayer and thought work and say, okay, what do I want the future to look like if and when I can do anything? And so I decided that I couldn't find the help. There was nobody, psychiatrists, psychologists, psychotherapists. There was nobody out there who was specializing in chronic pain and illness at the time. Now there's still not enough, but there's more. And I just decided I need to do this. I need to be the answer. And even if it helps a small handful of people, it's better than nothing. Because I didn't want anybody to go through what I was going through. And as I was sitting in these doctors' offices and seeing these young women and, all these different people and having these conversations and saying, hey, has anybody asked you about your mental, emotional health along the way? And the answer still to this day is always no. And they wait until we fall apart. And there's this societal kind of expectation of, pull your big girl panties on and just deal with it. And,
unfortunately,
it's really unfortunate. And it's not the case. It's meant to handle these, life-changing illnesses and not get the support and the skills and not have it affect you with anxiety, depression, fear, isolation, grief. All of these, it affects your relationships, it affects your career. I'm thankful to have a very loving family and a super supportive husband. I know that I'm blessed that way. Not everybody has that. And then certainly my mental health, right? It really crashed quite quickly when I stopped working. But here's the thing. While I was in corporate America for those 5 years, I wasn't living authentically. I had to hide it all. And as it progressed, I was traveling with, a suitcase of medication so I could do bladder installations every other night, and all these different things just to, keep afloat. And certainly in corporate America, it's not okay to be ill. You're in, the moment they find out, you're a liability, right?
Oh, yeah.
Right. We can't send somebody
Definitely.
like you out there, and we can't have that, right? And so it was like, I had to hide it. And I wasn't living authentically. And so one of the blessings, right, one of the positive things is that now my weakness is my greatest strength, right? My story, what I've been through is why people search me out, right? And how I can help other people. And it's not just because, I've been through this and this is my story. Not only, right, then I went through clinical training. I went back to school. which was an arduous process. And then all I treat is women with chronic health issues, anything from cancer to MS to fibromyalgia to you name it. And so I've seen what works, what doesn't work. And so it's kind of, I have this like triple threat type situation going on of my story, my clinical training, and then working, directly with people with a variety of illnesses. So I know, what's working.
Yeah, I definitely like that, your weakness has become your strongest point. That's a really great way to turn it around. And I think it's very amazing that you decided to be the answer. You're speaking to me so much right now because I'm going through all of these emotions and isolation and grief. And for me, I really want to go back to school and just do something different that would be more helpful. I think when we start to go through this, we're losing our old sense of identity. And now we have to try to find sort of who we are now. And I think you start to let go of some of those, kind of the American dream that we're all, brought up to want. We start to realize that it's not that important and that taking care of yourself is important and following, your passion to help other people. I don't ever want anyone to feel the way I feel currently. And so I think I can definitely, relate to you on that level. And, it's not easy. It's not easy to walk away from a career either, especially one that you're very successful at. And I just question this so much because I love what I do, but it's so taxing sometimes. And I just wonder, maybe I should be doing something else. So I think this is very eye-opening. I've never had really anyone on the show kind of put it this way. So I really appreciate you opening up about kind of how you got to your journey and that something that was, deemed as pretty taxing and you were grieving and you felt isolated probably and all these different emotions that you were able to really turn it into a positive thing. And now it's your strongest point. So I really think that's amazing. And I want to learn more about what you're doing on a day-to-day basis. So you're a clinical psychotherapist, and this is obviously now helping you on a personal level, but you're also helping other people really navigate life with chronic illness, especially women. So just kind of touch on your day-to-day, and then I definitely want to get into your initiative as a resilience coach and your, what it means to be fiercely resilient. So why don't you start with what your day-to-day is as a clinical psychotherapist?
Okay. Right. So my whole kind of goal and mission was the overarching was, okay, I want to be of service. I want to help other people so that they don't have to suffer the same way that I have, and, put some good use to this. And it didn't have to be big. It's now bigger than I had intended, and I love that. And I currently have the capacity, and so that's all a blessing. I see people. I'm licensed in the state of California to do psychotherapy. So I see people one-on-one individually. I also run different groups. And that's, a bigger part of my day-to-day. We are expanding the practice, and I will be training other clinicians and coaches. This is going to be coming in the fall, right? Like, how to do this kind of work, because I think it's important, and that's part of the legacy that I want to leave. That here's a solid program on how to help people, how to help them have the transformation of the mindset and the skill set. And I look at it as right suffering management, because I don't have access to unicorn gel or anything that'll make it all magically go away. But how we experience it. Right? We have a choice of, do I want to be stuck in a victimhood? in a mindset that I'm, catastrophizing and making things worse? Or do I want to do the work of improving my mental and emotional health and learn new skills that I'm truly not expected to have, right?
Yeah.
And so that I can cope better and I can move from just treading water, just surviving, just holding on to actually thriving. And so I believe in that resilience is taught and can be learned. There's a concept called post-traumatic growth, which is, and there's different schools of thought around resilience and post-traumatic growth. I believe they live together. And that what it is, right, and I'm an example of it, is that you take this traumatic event and then you learn how to leverage your own strengths. And you don't just return to baseline. You don't just bounce back, but you bounce up, you bounce forward, you bounce better than before. And so that is the basic theme that runs through everything that I do. And so in my clinical psychotherapy, right, I deal with all the aspects of the clinical side of it. So anxiety, depression, grief, but there's also some constraints regarding legalities and things that you can't necessarily talk about that in coaching you can do. So I love having the mix of both. And they're both helpful.
Yeah, that's definitely great that you pursued both sides of it so that you have a little bit more wide range and ability to really help people.
Yes.
So you have your website, which is fiercelyresilient.com. So tell me a little bit about that and what that entails and kind of what your main messaging is for people who visit that and are first-time viewers and they're looking for help.
So that Fiercely Resilient was born and launched last year at the beginning of COVID. It was in works for about a year prior. I've always had a portion of my business that's been online because not everybody can come in. And also not everybody can afford therapy. So as part of my mission, which is let's take mental and emotional health for chronic health issues and make it more widestream, more available, more easier to access, was, okay, how can we teach courses and provide group type coaching to more people at a lower price than therapy? And we can also talk about things like I'm trained in psychoaromatology, which is how to use essential oils for helping ourselves, which you don't really talk about in therapy, or other complementary and alternative things that you can talk to. It's also not everybody needs another diagnosis. And almost all of my diagnoses truly in the psychotherapy world are anxiety, depression, etc., due to a medical condition, right? So,
right.
We don't need extra tagged onto us. We need to learn skills, learn tactics, have solutions in place so that we can go through our day-to-day life and still look forward, right? So I've become basically a nerd, which I never thought that would happen. But I've also studied like neuroscience, neuroplasticity, how we can leverage the brain and biohack and go in, because there's a lot that doesn't work within us, but there's a lot that does. And so let's leverage what does, right? Do we want to focus on the obstacle or the opportunity?
Right. It's all about kind of retraining your brain and having a new mindset. So I definitely love that. And I like that you have provided a service that is more affordable because, of course, many of us with IC and and other chronic illnesses, we spend a lot of money on doctor's appointments, going from doctor to doctor, supplements, remedies, nutrition. There's a lot of costs that that are involved with this. And therapy, I feel like, is always kind of the last point. We try to take care of ourselves internally. We do all the different treatments that are, advised by our doctors. And then at the very end, it's like an afterthought. Oh, well, I guess I should work on my mental health. But really, like, some of this is caused from our mental health. I fully believe that. I know the reason that I have IC is because I worried and stressed out for so many years straight, 5 years straight, that then I ended up with having this problem. So if I had learned how to cope better in life and not let financial stresses, really determine my fate, I don't know if I would be sitting here doing this podcast right now, So I think it's so important to make that affordable and to make it accessible, via online or however people want to come in and do treatment with you. So I think everything you're doing is amazing and it's really important. And you're really hitting all the points that are pain points for all of us. So I think that's amazing. If you could, I guess you have kind of already defined it, but if you could kind of define it in a sentence, what does it mean to be fiercely resilient?
Right. So fiercely resilient is where you actively and consistently, purposely seek out solutions to move out of being stuck and into thriving by leveraging the strengths that you do have and stop self-sabotaging. Right? You can become empowered and emboldened to claim the life that you want and use creativity, because it's not going to look how you thought it was. But that doesn't mean it can't be great and it can't be even better than what you had envisioned.
Yeah, absolutely. I think a lot of us kind of find this to be a blessing in disguise, after we figure out how we can navigate through it. You've mentioned a lot with depression, isolation, grief, fear, those kind of being common emotions of, many people with chronic illnesses and maybe many of your patients. But I kind of want to just expand further on that. So what commonalities have you found when treating different patients, especially women, which is what you focus on, that have chronic illnesses? So whether that's commonalities with emotions, maybe their living situations, their lifestyle. I'm just kind of curious if you've picked up on anything that's sort of a common factor.
Right. So I think one which is really interesting, and I one of my goals is to do some deeper research on this. But one of the glaring commonalities is being a type A perfectionist, which also often goes back to childhood. And we know through ACEs, adverse childhood experiences, that can line you, right? It changes how your RNA is expressed. It changes your immune system, and it can line you for chronic illness, heart disease, cancer, all these different things, just because you experienced some form of trauma or neglect in your early childhood years. And that contributes to what I call a stress response. And we have 4 parts to our stress response. And it's the 4th part that people don't often talk about. So we have fight, flight, freeze, and the last one is appease or fawn. And that is, basically you're locked inside the cage with the tiger and you can't kill it, you can't run away with it. And you've played dead and that didn't work. So you have to, here, kitty, kitty, please be nice. Let me be perfect. Let me not upset you. Let me walk on eggshells, because that way maybe you won't kill me, right? That's the extreme example.
Wow.
Right. And so, but
wow.
This shows up as, having a highly critical or narcissistic parent. right? Or having a parent that wasn't emotionally available. It's not always just, physical or verbal abuse, although there is a lot of that. So that ties into, right, being in that fourth level of trauma is what usually fuels this: I'm unworthy and I need to do everything to try to be perfect. And this is certainly the story of my life, right? And so everybody that I see that has chronic illness, regardless of the diagnosis, whether it's IC, and I've seen a lot of people and worked with a lot of people with IC, or anything else, there's this perfectionist mindset, this, type A, try to figure it out. And it's only when like things are falling apart and they can't handle it anymore that they, choose to get help. And it's really something that if we're constantly telling ourselves, I'm unworthy, I'm a burden, I'm sick, I'm useless, well, our body is listening.
Yeah. And
if we don't tell it that it can heal and tell it that it is worthy, right? And at least balance it out a little bit and stop this inner self-sabotage, this inner dictator that we all have, and learn to control it better, it makes a difference physically. Because we all know that if we get emotionally upset or stressed with our symptoms, it comes out. We have more symptoms. We flare. We feel worse. The brain fog goes up. All of it is worse just by a shift of, well, we had an argument with our spouse or a family member or stressed at work, right? So there's that correlation. And so if we can adjust it, right? And all of these are adjustments, right? Nothing's ever totally going away. Although a lot of people have, I'm 16 years into IC, so I'm fairly well managed, but I've also had every single treatment out there, and still do, just to manage it, right? Mm-hmm. So I do bladder installations at home. I do pelvic floor PT. I, deal with my emotional and mental health. I watch my diet. I use lidocaine, compounded suppositories, fascia release. I get pelvic floor Botox and nerve blocks every 6 months, and I have an interstim, right? So I've had all of these things to help manage the IC. And so we have to combine all of these tools.
Mm-hmm. It's very important. I think mental health is always considered last, and it really shouldn't be. It's the protocol needs to change, that we need to start having doctors ask, what is going on in your life? Are you stressed out? I've never been asked that by a doctor. And I know they're not a therapist.
Yes.
They're not, they're not trained in that regard, but the protocol needs to change just as much as nutrition and dietary recommendations are now being considered by doctors. That wasn't always the first, plan of action for people is, here's a diet sheet, that's a relatively new thing. So I feel we can change it. Mm-hmm. And I feel it's coming. There's so much talk about mental health and putting yourselves first. And I think millennials are really pushing for that because we're such a different generation. Yes. We're like, no, we don't want to deal with that. Like we're a little entitled to, but I think it is changing. So it's very important. And I'm curious on, some of the feedback and outcomes that you've experienced through treating women with chronic illnesses.
Yes.
Kind of what the overall, I guess, outcome has been for most people that have been under your treatment.
Right. So before I answer that, I want to answer the first question about changing protocol. And absolutely, it is in the, the AUA guidelines. It talks about CBT, cognitive behavioral therapy. I think there's a lot more to that, right? But my goal is from the moment they give you a diagnosis, even if they don't ask you, right, it's not their domain, but they hand you a sheet and they say, okay, this will affect you mentally and emotionally. You do need to get help. You are not expected to just figure it out on your own. And here are some resources, and we will connect you. And it's addressed from day one.
Yeah.
Day one. Even before a diagnosis, right? Because sometimes there's not a clear diagnosis, and it's a process of months or years. And even when I was diagnosed with cancer, it was over a phone call. And, hey, you have cancer, you need to get on the phone, call surgeons, have a nice day.
Wow.
Exactly.
Wow.
Exactly. Right. So, and I hear this story over and over and over again from everybody that I work with, that you just get leveled with this life-changing stuff, and nobody ever says, hey, this is going to affect you mentally and emotionally. And we need to put support into place so that you don't have to feel alone. You don't have to, figure it out all alone. So that's definitely that part. So we need to change that protocol. I work with the ICA and everybody I can to try to advocate for this, because I think it would change. It would change the level of suffering that we all go through, and it would reduce symptoms.
Absolutely.
Right. Flat
100%.
out. And so, right. And, from a societal way, it would probably reduce healthcare costs, right? Like, because it wouldn't escalate so bad. So okay, right. I could talk for hours on that.
No, but, it's taking kind of the preventative measures. You get a diagnosis, your mental health declines, and then all of a sudden you have another mystery illness because all you do is stress and worry and you're grieving. So it's great to really try to pinpoint it as soon as we know that someone's going to experience a loss. You are going to grieve. Your life is not going to be the same. It's a really hard thing to wrap your head around at any age. So it's very important to do that.
Right.
So based on all of that, what have some of the outcomes been for some of your patients?
So overall, there's a sense of reclaiming control, feeling more empowered, certainly feeling emboldened to advocate for your own mental health and for your own physical health. Because sometimes some of the things that are done to women are very inappropriate. Again, could speak for hours on that, but we feel like we're not supposed to speak up because they're the doctors and they know better, and there's this shame. And so learning how to say, no, you don't get to talk to me that way. You don't get to physically treat me this way. Like, just because you're a doctor, that doesn't allow you to do that. And then overall, by improving the mindset and skill set, we see greater coping mechanisms for when things are out of control. And we see a reduction in symptoms every time.
Wow. That's great.
I had a call today. This woman called me in crisis and just overwhelmed and done. And we did, some visualization and some mindset working. And she was actually, she's a longtime veteran of pain. And she was actually shocked at her ability to that her mind would even let her do these things. Right. And I am by no means, do not misunderstand me, that I'm saying that the pain is in our mind. But it goes through our mind because our mind is attached to our body. we're one and the same.
Yeah.
The body sends signals to the mind sends signals to the body. We are what I call a whole being. And so the solutions in addressing whatever it is needs to be a whole being, mind, body, spirit, soul, answer and solution. And when we do that, of sitting in anxiety that goes up to panic attacks, which flares your fibromyalgia or your IC, all of it is reduced. And you feel you go from helpless and hopeless to feeling, okay, I'm empowered. I can handle this. It's not pleasant. I'm not saying, any of us want this, but it's what we have. So do we want to keep adding on to it and make it worse? Or, let's help to leverage what is working in our body for our benefit, because our body does heal. It's not going to, like I said, it's not going to magically go away. But if I think back to my first 2 years where it was like a level 9, 10 flare and I was in and out of the ER to now, right? One of the big things I teach is learning to listen to our body and give it what it wants when it wants it. Because quite frankly, we are great BSers because we tell the world I'm fine.
Oh, yeah.
And we hide it and it's invisible.
Oh, yeah.
It's invisible and then we hide it and we're not truthful with ourselves at the level that it is. And we're not truthful with those around us, right? Because we endure, we grudge, we go through it. We're like, I'm at a level 7, right? So if we communicate with our partner, one of the things I do, right, is creating your own personalized pain scale communication plan so that, hey, we're going out to dinner. You can tell your partner, your family, your friends, okay, I'm at a level 6 and I think I can make it, or I'm at a level 4, right? I'm using arbitrary numbers, but we communicate so that if you're at the event and we got to go, we got to go now, but the people who you are with understand, right, the nuances and the difference, because we're being more clear and more accurate with where we are. And we understand the difference. Okay, well, what is the difference between a level 4 and a level 5? Okay, then I can start inserting skills and coping and tools and medications when I'm more clear about a level 4 so that I don't go to level 5.
Right. Yeah, that's definitely important.
And if we would, and if we stop, right? So I have this too, like I'll have a full day and sometimes I have to cancel on my clients because flares come out of the blue, right? But I have found that if I stop as this freight train is coming and I notice, oh, this flare freight train is coming, and I stop and I say, okay, and I have a flare protocol that I've created, and it's something that I teach, right? So you have a flare protocol. I know exactly what to do, when to do it, and I implement it immediately instead of like, oh, I'm going to push through and do it later. Now, all of a sudden, my flares, instead of being days, are maybe a day.
Right. Yeah.
Right? Because I listened to my body earlier.
Yeah, that's important.
Yeah. And it makes a difference. It makes, right? All these nuances. If we, for us, if we can move our pain, a notch or two, that's a big difference in quality of life.
Oh, yeah, definitely. I think this is all very insightful, especially for me. I mean, just everything that you've said is really speaking volumes to me. And I think this is going to be a very beneficial episode for my listeners. So, just having these tactics and having that be the outcome that, this is your life now. You can't get lost in the fact that you're not who you were. and we have to learn how to proceed. So I very much appreciate your time, and I, am grateful for your story. I think it's very inspirational and it's very uplifting to me, and I hope so for others. And so I just really appreciate your time opening up and sharing your personal story with us today.
You're very welcome. And I'm just so glad that you have this platform and that you are doing this podcast and you're getting, all of this information and all the other people that you've had on. I applaud you for your mission.
Thank you. I never would have done something like this had I not gotten IC. So, always seeing the positive out of everything. So again, I really appreciate your time. And I also want to thank my audience for taking the time to listen to the Bladder Battle Podcast special series, Flarey Tales. Make sure to subscribe if you're listening on YouTube, or leave a rating or review on Spotify, Apple, Google. I'm even on Amazon now. And stay tuned for the next episode right here on the Bladder Battle Podcast.